Hello, good afternoon, everyone. Happy Wednesday. We're going to go ahead and get started. So we're just going to jump right in. We don't have a very busy meeting today, but nonetheless, really good information that we have. So we're just going to do a couple of announcements, and again, we're going to highlight our Not Alone. Our wonderful senior health educator Kavina will be doing that. We'll have our Epi update by Megan, and then lastly, we'll have our tobacco presentation. We'll go ahead with announcements. As you all know, our school health updates will be changing. We're going to be including the mental health aspect for a more well-rounded health outcome. And we're expanding this invitation to social workers and counselors. So if you have any social workers, counselors, or any other school staff that you may know that may want to join these calls or you think will be a good fit for these calls, you can send them our way at schoolsupport@pima.gov, and we can go ahead and get them on these calls. With that being said, we also have our monthly newsletter, and if you are not subscribed yet, you can click on that link and subscribe right there. That being said, Kavina, are you on?
Yes. Good afternoon, everyone. My name is
You're
Kavina.
muted, or it's
Hello.
can hear you just fine. Okay, never mind. Maybe it's mine. Go ahead.
Good afternoon, everyone. My name is Kavina Kamkanti. I am the senior health educator with the youth in schools, and I just wanted to talk about our youth mental health initiative called You're Not Alone. So we've teamed up with La Frontera to increase the access to mental health care services for youth and young adults age 24 and under living in Pima County. So this is up to 5 free therapy sessions with a master level therapist. After their 5 sessions, La Frontera works with them to ensure that they have wraparound services. So if a youth expresses interest in continuing therapy, La Frontera will work with them either with insurance that they may already have. If not, La Frontera will work with them to figure out figure out their insurance. When it comes to eligibility for these services, the youth must be 24 years or younger, must live in Pima County. If they are 17 years or younger, a parental or legal guardian must consent. Um, it's completely free, so no need of insurance, no need of proof of residency or citizenship. And so that link right there and the QR code will guide you to the referral page. It's going to ask for the youth information. You can fill out as much as possible. If you are a staff, such as a counselor or a parent, it will ask what kind of relationship you have to the youth, or the youth, if they're self-referring, they can just click youth there, and then just any additional information. And then La Frontera, that referral goes straight to La Frontera. La Frontera contacts the individual, and they start setting up those therapy sessions. It could be provided in person or virtual, all dependent on what the youth needs. So yeah. Yeah, so this is the landing page. Therapy, that orange box is what you would click, and that brings you to the referral page. It looks similar to the Pima Helpline landing page. However, it is La Frontera's website, so it goes straight to them. The county doesn't see any of the information shared with La Frontera.
Awesome. Thank you so much, Kavina. And if you have any other questions, again, you can also email us at schoolsupport@pima.gov if you're wanting to inquire more. With that being said, we have a respiratory update for COVID, RSV, and influenza presented by Megan. Megan, are you on the call?
Yes, I am. Thank you, Chris.
The floor is yours.
Excellent. Go ahead and have next slide, please. Okay, so we just started our respiratory season for 25-26. We are in week 43 of the year, but we're still beginning this respiratory season. We're starting with the RSV. As we can see here on this chart, we've got the 5-year average, which is the black solid line. The red dotted line was last year's respiratory season flow, and the actual little tiny chunks down here is this year. So we are currently 95% less than usual, which is amazing. We want to start out low. Typically around this time of year, we see an increase. Last year we did not. We had a very big delay. So we'll see if we're going to have a repeat this year of that. And this is just the new RSV that we're seeing, especially with all the vaccinations. Next slide, please. Next here we have influenza. Again, same concept. Solid black line is the 5-year average of influenza. The dotted red was last season, and you can hardly see it on this map. We do apologize, just the way it's skewed, but it is there. We still, again, only have 15 confirmed cases in Pima County, so we are starting off low, which is excellent to see, and hopefully we stay low. As a reminder, flu definitely does affect people age 65 and older, but our next population is the teen and adolescents who get most affected with influenza. So still great opportunity for everyone to teach respiratory etiquette, covering our coughs, and using that hand sanitizer and washing our hands. Next slide, please. And now we have our COVID-19 seasonal report. Same thing, 5-year average is that solid black line. It is cut off here because it is skewed with the beginning of the pandemic. It's the only way we can actually see that peak. And then the dotted red is last respiratory seasons. And again, here we are still starting off low. We still have a lot of cases, but it's not high compared to previous seasons. Again, kiddos 0 to 4 years of age are most affected with COVID-19, and our next age group is at 19 through 44. So let's keep up our good work, get vaccinated, and again, use that respiratory etiquette to keep these cases down, stay home when sick and not feeling well. Next slide, please. And here you see all 3 of the current season. In here, we've got yellow for COVID, blue for flu, and pink for RSV. And down at the bottom, when you do get these slides, you'll be able to actually see the website. I believe it's updated every Wednesday, so you can follow along when we're not having these meetings. And I believe this is my last slide. Oh, nope, sorry. Just a gentle reminder about reporting. This is the list here of what is reportable for schools themselves. You can always reach out to EPI to report this or straight to ADHS. You can click that link for an actual copy of this. There is a backside that talks about what exactly information ADHS or Pima County Health Department requires. And you can click that link to see the second side. And I do believe this is the last slide.
Yes. Thank you so much, Megan. I appreciate it.
Absolutely.
So next we have tobacco prevention presented by Angela. Angela, are you on the call?
Yes, and Jennifer was.
Oh, and Jennifer. Okay, I'll make sure I give her permissions.
Okay. Yeah. Let me see.
Okay.
Jen, are you able to?
Yes.
Hi,
Okay.
good afternoon. Yes, I'm also on here. So yes, hello everyone. Jennifer Lindstrom, Pima County Health Department Program Coordinator.
Thank you. Okay, we can go on to this. All right. So, hello, my name is Angela Montiel. I'm the program coordinator for the tobacco prevention program, Healthy School Initiative, and the Stand Youth Coalition. So we have a vape-free school initiative. Maybe some of you are already familiar with the Healthy School Initiative. And maybe you're a wellness coordinator with our Healthy School Initiative. So we here at Pima County the Health Department have been in our 5th semester, school semester. Prior to that, it was called Coordinated School Health. And then we changed the name in 2021 to Healthy School Initiative with the emphasis on strengthening the vape-free schools and smoke-free schools initiative. And so this slide shows how we do our vape-free school initiative in partnership with the American Lung Association. We collaborate with them to provide 4 different options, encouraging students to make informed decisions about electronic cigarettes and vaping to protect their health. And so tier 1, you'll see that we have policy toolkits, which is the Pima County Healthy Schools Initiative, the Vape-Free School Toolkit Policy Assessment Workforce Development. And we also have our prevention curriculum we use, which Catch My Breath, and asthma basics, tobacco basics, and ACT, which is curriculum certification from the American Lung Association. And we also have the Stanford Toolkit, which has a nicotine vape prevention program curriculum there. Also provides uh, other awareness, smokeless tobacco and cannabis awareness on that one, which will refer our schools to that since we're focused on nicotine prevention. And then we have our tier 2, which is our alternative to suspension. So in-depth. In-depth is an alternative to suspension. So in lieu of if students get caught vaping or smoking on campus, instead of getting suspended and missing school, they do an alternative to suspension, which is in-depth and in-depth online. In-depth online is being used by the Marana Unified School District currently, the Vail School District, and the um, hopefully all Flowing Wild School District as well. And then also the Education and Cessation Program, which is not on tobacco, that we call it the NOT program. That is a education and cessation program for youth. So it is voluntary. So if youth say I'm addicted to vaping or smoking, they can um, in their schools we have some wellness if there is a wellness coordinator trained in not, then they will be able to get that program. Okay, and go ahead and next slide. And then these are just QR codes. So if they're working QR codes. So if you want to learn more about in-depth, you can go to that QR code. And the alternative suspension, it's 4 group sessions at 15 minutes each. And then the not is not on tobacco and Catch My Breath, which is for youth ages 10 to 18. And then, of course, our Healthy School Initiative. If you would like more information, currently we are full. We are at our capacity for schools. However, if you would like more information or if you would like us to present at your school, we'll be happy to do that. We'll be opening up more an invitation for more schools in May of 2026. The next slide, please. And then this is just an example of the schools that we have currently in 25-26 school year. Okay, next slide. So our STAND Youth Coalitions, we have had STAND Youth Coalitions for the almost 10 years now. And so there you see there's Superintendent Dustin Williams, School Superintendent, our manager, Leah Tooley Clayson, who has been many years with STAND Youth Coalitions. We have our Empire Youth Coalition, our Anza Trail, and our Tucson Indian Center Native Youth Coalition. Go ahead, next slide. And this is just the spring training that we had at main event. These are youth who do peer-to-peer in their schools and their communities. Also, they were a part of making some policy changes. So we are very proud of our Stand Youth Coalition. Okay, next slide. And so this is just a mission statement of we have for STAND. STAND is statewide, Arizona. There's a STAND Youth Coalitions in every county. Our coalition, STAND Youth Coalition mission it's an acronym for Students Taking a New Direction. Arizona's Anti-Tobacco Youth Coalition. They work to raise awareness about the dangers of commercial tobacco and electronic vapor products used among peers in their community and their local government and with their local government. And the STAND Coalition exists statewide to prevent youth and young adults from beginning to use commercial tobacco products, including electronic cigarettes. Next slide. And so what do they do? Well, our STAND Youth Coalition members learn about the harms of tobacco and gain the skills to advocate for change in their community. Coalition members participate in educational activities, conduct peer-to-peer education, and make presentations at schools and other community locations, and attend community events to bring awareness of the dangers of commercial tobacco use. And coalition members also participate in and lead advocacy activities open to young adults. Later on, Jennifer is going to be talking about blackout tobacco, and during blackout tobacco, we also focus on our Keep Tobacco Sacred messaging, because we know that commercial tobacco is not sacred ceremonial use of tobacco. And so just an example, we have many our youth coalitions and our Native youth coalition especially, and tribal youth coalitions throughout the state of Arizona, who also bring awareness to their communities about the difference between commercial and traditional tobacco. And so this year we're going to be having a fall training, which will be September 19th, where we'll be meeting all of our youth coalitions. We'll be meeting at the Keno Sports Complex, and we're going to have a stand tobacco Olympic Games. So it's going to be a lot of fun. We're going to be doing some tobacco facts and a lot of fun activities there on the fields of Keno Sports Complex. And then we will be, the following day on November 20th, will be at Hakami Plaza, which Jennifer will be talking more about that. Thank you. And next, oh, we have one more slide. I'm sorry. So the strategies of the coalition, of course, is to educate the community and about making decision makers on the evidence-based strategies to prevent initiation of tobacco, including e-cigarettes. That's using those evidence-based curriculum like the Stanford Toolkit and the Catch My Breath and the American Lung Association Tobacco and Asthma Basics and Act training, and establish and strengthen the tobacco-free policies in schools and university campuses, and prohibit the sale of flavored tobacco products, including menthol and combustible products, and reduce the exposure to tobacco industry marketing, including advertising, sponsorship, tobacco imagery, and promotions, and other than price. Okay, next slide, please. And so these are the 4 Stand Youth Coalition: the Anza Trail K through 8 SWAT, which out of Sahuarita Unified School District. They have the ages 11 to 13 years old. Empire High School SWAT, out of Vale School District. Their youth ages are 14 to 18. And the Tucson Indian Center Native Youth Coalition, the ages are 8 to 17. And then the City High School Youth Coalition, they're 14 to 18. They also include their middle school. Next slide, please. And then I'll turn it over to Jen.
All right, thank you so much, Angela. As Angela highlighted, tobacco products, we think of cigarettes, of course, and vaping as well. But we also wanted to share this new fact sheet that we have that's about the real deal on nicotine pouches. So when we speak about tobacco products, we're really, it's inclusive of all nicotine products. And these are especially new. These are products that are, as most of them are, these new emerging products are targeted towards youth. And as we can see, the packaging resembles everyday, mint containers, candies, in the very same shape and size as the containers that those come in. So this flyer, it's available in English and Spanish, tells us about just some facts that we know about these products. Firstly, how they're used, some of the common terms for these products that youth might use, that you might hear, and also the health effects. This is something that is of particular concern because of the level of nicotine that's contained in these. Because they're very discreet, it's very difficult to tell if somebody is using a nicotine pouch. And so they can be, easily concealed and used by youth. And so this fact sheet does have some kind of key takeaways, as you can see here. Things to look out for, potentially could lead to things like nicotine poisoning, which can have some specific physical signs, and also just changes in mood and behavior as well. And so on the bottom of this flyer, there's two QR codes. The first one, it's a little bit difficult to see it, but the QR code, the first one is for My Life, My Quit, which is the youth program for Ashline for youth 13 to 17 years old. And so that particular QR code will link directly there. There's also the chat feature and phone. It does require parent or guardian approval, which is easily achieved just on the phone. They can give that verbal consent. And then the next QR code is for anybody 18 and over. Once again, this is a resource that we have available. If it is something that we can provide to you, please let us know, and we would be very happy to deliver some flyers to your school, and just to ensure that you have that available for your information and resources. Thank you. The next slide, please. So coming back to blackout tobacco. So as Angela shared, blackout tobacco is our county specific campaign that aligns with the Great American Smokeout, which is the national campaign. And so it's our mission to block out tobacco. This is going in its 9th year now. So our annual campaign aligns with the Great American Smokeout, and it will be taking place Thursday, November the 20th this year, at Hakome Plaza downtown from 11 to 1. So across the nation, the Great American Smokeout serves as a catalyst for tobacco users to quit tobacco for the day, month, or forever. Blackout Tobacco also invites tobacco users to save money by quitting to improve their well-being, families, and pets' health for life. The next slide, please. So this is an exciting incentive. So this is the Blackout Tobacco Pledge event. And so what this does is just encourages those of us who might use tobacco products to quit them for good and take a pledge. And if you do this online, on the link here, this is also on our Pima County Health Department tobacco prevention webpage. We have a whole page just on blackout tobacco. But if you do take the pledge, you have a chance to win a $25 gift card that will be announced. The winner will be announced during the event at Blackout Tobacco downtown. So it's just for our community to be together, to all just taking this important step towards a healthier life. And we know it's a journey. And so no matter if you're starting the process of quitting or you are there to support your loved ones, just knowing that the support is there and the resources are there to help you quit successfully. And in addition, there'll just be more resources available to help you quit and learn about other Pima County Health Department services as well. Thank you. And next slide, please. And as November is also Native American Heritage Month, and so not only in November, but always we emphasize our messaging for keeping tobacco sacred. And so what you see here, every year we have this a campaign for Keep Tobacco Sacred. We have a community painting And the beautiful artwork that you see here was created by Mario Valencia, who's a Pascua Yaqui artist who creates these beautiful paintings to show us all of the ways that tobacco is sacred. And so when we talk about tobacco products, we distinguish between sacred tobacco and commercial tobacco products. And so there are two ways here in Pima County. The Pasquayaki and the Tohono O'odham use sacred tobacco for ceremonial and religious purposes. And so some of the ways that the tobacco is presented you see here on the slide in the clay bowl and also in the abalone shell. There's a photo here of Superintendent Williams with our painting from last year, I believe, during our event downtown. So we'll have a similar setup again this year. So it'll be very exciting to see that once again. And next slide, please. So here are some key differences between traditional tobacco and commercial tobacco. For example, traditional tobacco is not inhaled. It is not addictive. It is for sacred, ceremonial, and purposes. It's natural, curative, medicinal, and healing. And it is for social and binding of contracts. And so commercial tobacco is inhaled, it is addictive, it has added chemicals, it is processed, profit driven, and readily available. It is directly linked to cancer, heart disease, excuse me, type 2 diabetes, lung disease, dementia, and early death. And it is disrespectful to others. Next slide, please. Here are some ways to get connected to our program and to Blackout Tobacco. So you can see us on Facebook. We have these links here. You can also visit our Blackout Tobacco portal. That portal also has a lot of different ways to share the messaging for our campaign. So definitely encourage you to visit our webpage. And if you ever have any questions for us or would like some resources, you please email us. That tobaccofree@pima.gov is our program mailbox or shared mailbox. So we will be sure to respond to you promptly. And we are here to support you all and provide any resources that you might need. And we can also be contacted at the phone number there as well. And the next slide, please. So if there are any questions for us, we are here, and I think that's all for our slides. Thank you very much.
Thank you so much, Jennifer. So yes, if you have any questions for Angela, Jennifer, or Megan, or Kavina, now's the time. You can put your questions in the chat. And if not, I guess I'll give you all a moment to see if anyone has any questions. I'm seeing none. So with that being said, we can go ahead and give you back 30 minutes of your time. If you do have any questions that do pop up, you can always call us at 520-724-7018 or email us at schoolsupport@pima.gov. And again, if you know anyone who may benefit from these calls that is at your school site or maybe at a different school, please go ahead and feel free to reach out with their contact, and we can go ahead and get them on these calls as well as we're transitioning into a new era of the school health update. So with that being said, thank you all so much. I hope you have a wonderful Wednesday, and we'll see you all again on December 3rd when it's a little bit more chilly outside. So I hope you all have a great Wednesday and have a great rest of your week.